So a lot of times when somebody finds out that they're positive, there can be depression. There can be a lot going on in that person's life. And I'm like, do you really want to withhold hormones as well?
Welcome back to Positive Voices. And listen, we're continuing a conversation that we had earlier just about what it meant to be trans and the trans experience and giving voice to that. We have Dr. Selena with us again, medical pharmacist. Listen, you know, working in the field of HIV where I come from, and you work at an HIV clinic currently, we used to have a joke that there's a lot of like folklore. We used to actually call it trans folklore. Like people that of trans experience having different ideas about things they heard on the street. And some of the things you talked about in the episode that you filmed with us was that when you don't have a seat at the table, you sort of are left to your own devices and hearing from your homegirls and hearing from your elders. What kind of myths and folklore and information would you like to clear up for people in the trans community living with HIV and beyond?
I actually love that you started with that because one thing, so just a little bit of background. So I am an HIV pharmacist. I wear a lot of different hats. One of those hats is training providers and pharmacists. So I train nurse practitioners, I train PAs, I train physicians on how to prescribe and treat trans people. So one of the things that I always tell those providers is that your patient a lot of times probably knows a little bit more than you. Not a little bit, a lot of it more than you. And so essentially what happens whenever you're, let's say, bringing a drug to market, in one of those trials, you're wanting to know all the side effects, right? And you're documenting them and you're putting them into a study and you're putting it out there, and that's kind of how you read all that. But with trans folks, that doesn't happen. So a lot of what people say on the streets, they have a lot of truth to that. So whenever your homegirls or your homeboys are telling you how you can transition, many times there is truth. And I'll give you an example. So I gave a lecture at Trans Latinx in New York City. And they were saying, I really like birth control because that was some of the first hormones that came out because my breasts grow a lot faster. That's valid. That's true. There's a conversion with estrogen that happens where that happens. What happens is with birth control, there are a lot more side effects. And so in these times, I don't necessarily say that they're myths because they're not. I let people know the pros and cons of what they're doing. So, and I give people also options. So are you looking to improve what your breasts look like? Okay, have you ever thought about this dose of progesterone? And there's no studies on progesterone on that. But from our homegirls, we hear it helps with sex drive, it helps with my breast development, and there's science behind that too. So whenever we have trans patients that come in, I kind of want to learn about where they learned about hormones. Sometimes they'll come in and be like, I don't know anything. And I'm like, perfect, clean slate, I can tell you a little bit more. And then there's other times where like, well, my homegirls are saying that if I inject this and do that and do this, I validate that. I don't say that that's wrong. This is how the girls have been doing it for years. But I give them pros and cons. And I'll give you one example is I had a trans woman come in and we were giving hormones and their liver enzymes were insane. So that can either mean, drinking or drugs or whatever. And so this patient's like, I don't do any of those. And sometimes they're telling the truth and sometimes they're not. And I kind of pulled her aside and I was like, sis, what else are you on? And she was like, nothing. I said, sis, what else are you on? You know? And I kind of gave her the femme queen just like, and she's like, I'm on this and this and this and this. And I'm like, you're overdosing yourself. So, So in those cases, I want to build enough trust with the patients so that they're able to tell me what else they're taking as well. So as far as folklore, I try to validate where that comes from or try to research how that came about. And sometimes it is dangerous and sometimes they're doing a pretty good job.
Because they're the subject matter experts, right?
Yeah. They're the subject matter experts.
Yeah. That makes a lot of sense. So question I have, I know back when I was doing the work, it's been a little while since I've been, front lines. Sure. But when I was doing it, access for people of trans experience depended upon if they were HIV positive. It depended upon whether or not you were undetectable. Viral suppression Viral suppression is what undetectable means. Viral suppression determined whether you were going to get care. If you wanted top surgery, bottom surgery, hormones, like everything kind of depended upon you being virally suppressed. Is that still the case? And what can you say to that?
So I actually got that question a few weeks ago from a nurse practitioner, and they said somebody just tested positive. They want to also start their hormones, and can I start that on the same day? And I said, why would you not? And I try to ask these questions back to them. Why would you not start them out? Well, da 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 da. Well, so a lot of times when somebody finds out that they're positive, before they realize their options, before they realize what undetectable is, there can be depression. There can be a lot going on in that person's life. And so I'm like, do you really want to withhold hormones as well?
Yeah.
Like but they're like, well, what if they have a mood swing on hormones? And if somebody is asking you for hormones, there's really no reason why you need to deny them those hormones. I think back in the day when HIV medications were pretty rough on kidneys and pretty rough on the liver, a lot of times people were like, I just want labs to come back. But what providers need to understand is they will go to the streets and dose themselves. So you can either dose them appropriately, or they're going to dose themselves somehow else and then maybe not come back. And so we find that when trans women and trans men are given hormones, they're more adherent to their regimens. They're going to come back. They're going to come back for that.
Right. And that's important that you say that. I've actually heard providers on teams I've been on say that they literally use hormones or surgery referrals or things that, because you need them. You need the referral for the behavioral health specialist if you want to have surgery and like have a diagnosis of gender dysphoria. Like you have to have all that. So they say I use it as a carrot to dangle in front of it, which never felt right to me. It felt like, you talked about having mood swings. Here on the show, we've had a lot of people come on the show and talk about their experiences with depression, how it affected adherence. None of those people, to my knowledge, were of trans experience. What's the difference between them? So it is kind of another way people are treated differently based on their identifiers.
So I really love that you said that, because as we talk about mood swings, you have hormones whether you're injecting yourself with estrogen or testosterone. And so the way that you're dealing, you can even think about cis women when they're menopausal or just once a month. And people deal with hormones differently. Hormones are going to surge up and down depending on cycles. But we learn how to deal with that, if that makes sense. So in cis women, for example, a lot of times in sex ed, you're learning, okay, this is what my cycle is going to look like. This is what I can expect if you had a good sex ed program. But for trans people, we never really learn about those cycles. So whenever we're injecting ourselves, we never really learn that, okay, 2 days from now, my hormones are going to be pretty high. I might have a mood swing. But a lot of times when you're going to a provider's office, they're kind of blaming everything on that. Your depression is from your hormones. You're not adherent because of your hormones, or they're blaming a lot on the hormones when you can actually really use that as a tool to help people heal. And so whenever we think about surgery, for example, it was pretty custom to take people off of hormones while they're healing. And then people kind of fall into like this post surgical depression. And you're like, well, we don't do that to cis people. We don't clip their ovaries or clip their testicles until they're done with surgery. So then why do we do that for trans people?
Absolutely.
Can I ask you a question about that? So what would be the point of like stopping stopping the hormones for recovery, right? Because like you just said, it causes all of these adverse things. So what would be the point, if any?
So that's a really great question. So it kind of goes back to studies. So because studies were never done on trans people, it was mostly what people were using in the beginning was birth control for trans feminine people. And the high doses of birth control can lead to thrombosis. Whenever we were having people go through surgery, we're like, well, we don't want thrombosis, so we don't want you to be on these hormones. So then as more studies are coming out, we're kind of realizing that estradiol doesn't have those same side effects, the same doses. There was not really a reason to. And if there is, for example, then we treat that. There's medications that we can give post-surgery to make sure that doesn't happen. So, and that kind of goes back to what we were talking about for cis women, for example, or cis men. We're not pausing their hormones due to side effects. We're treating what could happen based off of levels and science.
Yeah. As a pharmacist, talk to me about those levels when it comes to what your provider is prescribing versus what you are taking from a friend or what you got on the black market.
Sure.
Yeah, because I just have had experiences with trans women where like you're looking at their labs and you're like, have you been crying randomly? Have you been like, and you're like, because what the labs show me is that, and then that's when they'll admit it when you say something to them.
What is really difficult about prescribing hormones is there's not really any guidelines or medical board that oversees this. And then there are a few, and they all disagree with each other as far as levels. So when I have a patient, I'm more asking them what are their goals, how do they feel? And I'll just give you a quick example. Myself, sometimes I can't get out of bed and I'm just like, what is going on? Something's going on. And luckily I work in a clinic, so I get to go next door and we're like, can you draw my blood and see what my testosterone is? And if my testosterone is way too low, that makes sense. I'm like, oh my gosh, that makes sense.
Yeah.
Because whether you're trans feminine or trans masculine, you need both.
You need both.
So I would say that the importance of getting your hormones from a provider or somebody that is able to monitor your labs is we're seeing what type of hormone it is, because some hormones have more side effects than others. And then we're also able to track those labs and then kind of ask you, how do you feel?
Yeah.
What are you feeling? And so I got my labs a few days ago and I've been feeling great lately. And my testosterone finally went up, and that's something that I wanted. And it was one of my personal goals, because even though you're trans, you can't have a testosterone at zero or close to zero.
You don't
go
want
insane.
to. You don't want to.
You can't think properly. You can't wake up in the morning. Or as far as like when we talk about sex work, you can't work. So I talk about, do you do sex work? And we talk about their testosterone levels and where we want that at. And
That's a really new thought, right? That I didn't know. So I learned something today. So a question about that. So I heard you say when you're in your trans journey, you have both, right? You'll have estrogen and T. And so as a parent for a trans boy, he's going to be starting T, right? But we know that his feminine things irritate him. When he has his monthly, we call it a T-shirt. You know, when he needs pads, he needs more tank tops, right? And so like, it's all of these code words that we've had to like learn, because he just like, yeah, I need T-shirts. And I'm like, I just bought you a pack. Like, you know, y'all just bought you, we just was at the store and got you a whole pack. And he's like, not that kind. Got you.
Yeah.
Right? So could you tell us and me, right, of what happens with, so like now he has estrogen. When he starts the T will start to do what it does. So what happens with the estrogen that he has?
So they oppose each other. So as testosterone's going up, estrogen will level itself and start going down. During that time, you're kind of at a loss for energy. Your body hasn't really learned how to process the other one as energy yet. Migraines, for example, are another side effect of like not really monitoring your estrogen. So I think when we're starting our journey, we were like, I need this other hormone at zero, and you're not really understanding that everything's a process. So in these guidelines, we do start patients out with an initial dose, which is a low dose. And I explain to people that this is a process, that you're not wanting to necessarily eliminate one hormone very quickly. And then we move on to the next dose, and we move on to the next dose. And so I guess what I'm trying to say is there is function for both, and there are some trans people that are on both for different reasons. Whether that's vaginal dryness or atrophy. So then at that time, maybe they can start a topical estrogen instead. So then we get to those conversations as well, because there's still people that want, they don't want vaginal atrophy, and they don't want, they still are very functional as bottoms. So.
Yeah, no, that makes a lot of sense.
Yes, thank you.
Listen, you have the knowledge. You have the, and I want to say to UT, great parenting. Great parenting for creating that space. I think that if there's anybody who's watching and like wondering like how to make space for their trans child, you just gave some gems. So shout out to you.
I mean, because thank you for that. But I think just it's accepting people for who they are, right? And so I have to see, and my wife have to see, that our son was born a son, right? And then the outward appearance just didn't match with how he felt, but to see the daily struggle of him being in this feminine body with these feminine attributes and like all of these feminine expectations, right? It was like, no, this is not it, right? And so like, who are you? How can we empower you to be more of you? And so that was conversation. That was, I like male clothes. I like suits. I like to smell good. And so like we do field trips. Like we go to Macy's, we go to Nordstrom. He wants to smell colognes. He wants to know what's going to smell good with him. And then he's going to be like, okay, all of this smells good. So now I like this. And I want to wear suits to school because I'm a gentleman. And you are, and you wear it, and we're gonna go get you the most expensive suits. So when you click clack with your Chelsea boots, because he likes Chelsea boots, right? When you click clack through the school with your Chelsea boots, you let them know that you are a man coming through. And so it's the empowering. For me as a parent, it's like empowering. I don't even want to say his decision, because I don't feel like he was given the decision, right? He was born as a boy. And so
But
for
definitely
us,
his truth.
right, his truth, right? And so for us as his moms, it's like, how do we empower that truth? You know, and so let's get you to where you want to be and figure out everything else. Like speaking to wonderful doctors now, right? With questions about tea and hormones.
How old is he?
He's 16 now.
So one thought that crosses my mind is that empowerment is illegal in many states. So we're not allowed to use chosen names in Florida, for example. They just outlawed that. You have to have parents' permission for that. So in a lot of places, so the Endocrine Society says at 16 you can start hormones. That's when it says. I don't think you need to start hormones sooner than that unless you're wanting to freeze puberty, which is a different approach and a different way.
It's a whole different conversation.
It's a whole different conversation.
Yeah.
But as far as starting hormones, that's illegal in many states, which is crazy.
You say illegal?
Illegal.
Oh, wow.
I think it's Texas, a few others off the top of my head. I can't remember them. But yeah, so I think what you're doing is really wonderful. And I think that asking these questions, it's not really talked about and it can't be talked about in a lot of places. But yeah.
Before you go, though,
Sure.
I definitely want you to, what about STIs? I mean, because we all having sex. One thing we talk about here is having sex.
Hello.
And so, like, I just want to hear, like, how does STIs fit into transitioning, taking hormones, things like doxy-pep, and, like, what does that look like?
I really like that you brought up doxy-pep. So doxycycline is an antibiotic, and it's pretty broad spectrum in the sense that it treats all kinds of things.
Okay.
So we started prescribing it as doxy-pep pretty recently, but doxycycline's been used for years.
Yeah.
So when PrEP came out, which is to prevent HIV, they put in the guidelines every 3 months you have to do STI tests. And people started getting STI tests every 3 months. But what happens in those 3 months is you can become positive with a different STI. So then the conversation was, well, how do we prevent? Do we get tested more? Well, insurance a lot of times doesn't pay for more than that. So you kind of have to find a free clinic, and the free clinics are not everywhere, and they're got really long lines, and you see all your friends there, and like you're like, oh my God. So doxy-pep, essentially how it works is you dose yourself after you have unprotected sex. And so it should prevent against chlamydia, gonorrhea, syphilis. But you also have to realize that there's a lot of resistance. So gonorrhea is forever evolving. For example, chlamydia, we just changed the guidelines on that. So we're treating it differently than we did 2 years ago.
Okay.
So doxy-pep is going to kind of eliminate that replication of those bacteria. And people just need to know it's not 100%. But if you're doing sex work, or if you are not wanting to test positive for anything for your own reasons, it's up to you. So I got it prescribed for myself. I do sex work sometimes. Do I take it all the time? No, I prefer a lot of times to get tested. That's my choice. So, but I want the choice to be yours.
And does it interact with, like, if someone is trans and maybe they're on testosterone, or they're trans and they're taking estrogen, is there any interaction?
There's not.
Awesome. Thank you.
There's not.
Thank you for sharing that.
Just a follow-up question, right? And I think you may have answered it, but I'm not sure. So does the hormones, does it leave you more susceptible to be able to contract like HIV or STIs, or because like the immune
I know
system
what
is
you're talking
altering?
about. Yeah, no. But a lot of times that gets brought up because of needle sharing.
Okay.
So back in the days, before the girls could get or the boys could get access to hormones, people were needle sharing.
Okay.
So that kind of got brought up like, oh, it can lead to HIV, and that's not from the hormones. That's
It was
from needle sharing.
Right. Okay. So folklore, like another folklore
Yes.
that was brought
But
up
it's
to the
valid.
table.
There's
It's
a
about,
validity.
and the
So-
folklore, I think what we're hearing is that the folklore is rooted in
Yes,
truth.
and truth.
Yeah.
But we just need more big docs
Yeah.
at the table who have the experience, who can kind of speak to that.
Yeah.
Thank you so much for
Thank
being
you
here.
for that. Yes. So if I could ask you one more question. So as a parent, right, because I'm sitting here as a parent. So as a parent, what tips, if you could, give us like maybe 3 tips for a parent who has a child? And in our earlier interview, our other guest, Deja, says, moms know, right, pretty early on. So what could you say in this magical world of wish lists to parents, like 3 tips if you recognize that your child is due for their transition, right, to be able to live in their truth? What tips could you give?
Oh my gosh, this is so difficult. Tips to parents. Well, I'm not a parent, but so I'm like trying to
Speak
think
from
of,
your parents'
I know, that's what I'm
perspective
trying
to
think
you,
of.
yeah.
And then I kind of get emotional about it too, because I'm like, still my family calls me my dead name, and
Wow.
he, him. So
Yeah.
I guess like we talk about pronouns and chosen names a lot, and sometimes you might feel like we're beating a dead horse, but we're not. So asking them, and also everyone that presents as either feminine or for who they're supposed to be and too masculine. Not everybody wants to transition. Some people love being androgynous. So I think also holding androgyny to be valid as well. And so I think a lot of times when somebody's young and might look like they want to transition, just listening to them and being like, do you like to be androgynous? Are you non-binary? And then not necessarily needing to rush hormones. I think sometimes people can be too supportive and like, all right, let's get to the doctor right now. Let's start hormones. You can transition at any age. You can detransition as well. So I think having the choice, letting them lead the way, but also trying to find groups with people that look like them, I think is also valid. The main reason why I moved to New York City was to be around other trans women. And that to me was empowering. So I think also supporting them, having a friends group, friend circle, whatever that looks like, is
Community.
important. Community. That's what it is. Community.
Yeah,
Yes.
community.
Wonderful.
Sure.
Wonderful. Oh, I feel full.
Oh, do you?
And I hope you guys feel full too, with just the deeper conversation, to have a pharmacist, right?
Yeah.
And that's doing the work that lives your truth.
Yeah.
Is impactful and very powerful. So
Thanks. I appreciate
yes.
that. And there's a lot of providers out there that are doing their work. A lot of doctors, a lot of PAs, a lot of nurse practitioners that are doing their work as well. So I think healthcare in our lifetime is going to look a lot different. But right now it's a little rough.
transitioning.
It's transitioning.
It's
Right.
transitioning.
Yeah,
That's a good word.
P, where can people go if they're looking for resources?
Listen, we have a wonderful site set up for you. If you want more resources, if you want to find out more about your options, right? Head on over to linkudmv.org, LINK, big U, dmv.org, and put your zip code in. It'll populate all of the resources in your area for you, from testing spots to rent, okay, to, you might need a little voucher for something. Go there, put your zip code in, it'll populate the list for you. Also, if you want to just check us out more, you want to see what last season was talking about, what we're doing this season, we have a spot for you. Head on over to dcnshiv.org/podcast. That's the line that go like that. And you'll be able to click up top, watch more episodes, fill out a survey, as well as connect to us and all of the spots that this podcast will be available on. Speaking of, when you view it, listen, y'all know what it is. Like, share, subscribe, Tell a friend to tell a friend, because we want to get the word out that Positive Voices is here and we have you just like you have us. We'll see you guys on the next episode. Positive Voices Season 2, baby. We up out of here.
Bye, y'all.